Hi, welcome to part 2 of the nutrition lecture for NUR 200 or the mobility class. We left off, beginning to start on water with part 1. So remember, water is the most important nutrient because all of our cells depend on it. Water does compose about 60 to 70% of the total body weight. And our fluid needs are met by our consumption of water and also by water produced when food is oxidized. As you remember, your infants and older adults are the most vulnerable to water deprivation. The abbreviation, of course, is H2O. And water is the major constituent of blood. It helps maintain the blood volume and the blood pressure. It is a solvent in which chemical reactions occur. It is a medium for transporting different substances such as blood, lymph, or waste. It provides lubrication, particularly for our joints, mucous membranes. It helps contribute skin turgor, especially to our cells. It can regulate our body temperature because it helps with evaporation for when we get overheated and start perspiring. And our water intake should equal output. Adults need about 1,500 to 28 mLs per day of water. Rapid weight changes usually reflect fluid balance. And daily weight is the single most important indicator of fluid status. So remember, a lot of times we do like to ask if the person loses 1 kilogram, or which converts to 2.2 pounds, how much does that equate in fluids? And it's about a liter of fluid, or 1,000 mLs. So remember, we need to drink in 8-ounce glasses a day of water, or 2,000 mLs. But if we lose weight, or even actually if you have a rapid weight gain, for example, in congestive heart failure patients, each 2.2 pounds that they gain rapidly, like for overnight or something, is about a liter of fluid. So that's a lot of fluid excess in the body sometimes. So remember, if someone's gaining or losing weight very rapidly, keep a close eye on INO. We've talked about macronutrients earlier. Now let's talk about micronutrients, your vitamins. These are chemical compounds, and they're called micro because we need them in small amounts to regulate our body processes. They facilitate chemical reactions. They're required for metabolism of energy, but they don't provide energy. So just taking a vitamin is not going to give you more energy. They are classified by their physical properties. Are they fat-soluble or water-soluble? And just think in your head, what were our fat-soluble vitamins? And they were A, D, E, and K. They require bile for absorption. They are absorbed from the intestine, and they are not excreted when we consume them in excess. So remember, if you're taking high megadoses of these fat-soluble vitamins, they will build up in your body because they're stored in the liver and in our adipose tissue. That's why, in order for someone to have a deficit in one of these vitamins, it may take months for that to really show up. We don't have to have these 4 vitamins. We don't have to eat them daily. And actually, they can be toxic when consumed in excess because they do build up in the bloodstream or in the body. They're stored in the liver and in our fat tissue. These vitamins are soluble in fats. So what happens if someone's fat absorption is impaired? For example, maybe they've had part of their stomach removed, part of their colon, so they're not absorbing as much fat, then you may have deficiencies in these fat-soluble vitamins also. Vitamin A, of course, as you know, is an antioxidant. It helps prevent cell destruction. It is the precursor is carotene. It is needed for our skin maintenance, to help our bones and teeth grow. Yes, it is helpful and for night vision. And we get vitamin A especially from dark green vegetables such as collards, spinach, broccoli, cabbage, and also yellow fruit and vegetables like carrots, squash, sweet potatoes, cantaloupes. If we have a deficiency in our vitamin A, we will have dry, scaly skin, and you may have night blindness. It is fairly stable in heat, but sunlight will destroy vitamin A. If we become toxic, if we have an overdose of vitamin A, then you will literally see the skin turn yellow on the person. And it's called carotenonemia. And I don't know if you've ever seen that before. If someone consumes so much yellow fruit, like so much yellow vegetables, like in excess of squash and carrots, and don't eat other sources, they truly may turn yellow. But it's not jaundice, and it's not their eyes, it's just their skin is turning because of the excess. It is considered harmless usually, because then when we quit eating as much, the skin color will return to normal. Vitamin D is also your sunshine vitamin, and it is regarded as a hormone. It helps our absorption and mobilization of calcium and phosphorus, help with our development of bones and teeth. We get vitamin D from milk and milk products. Sunlight, but we need it about 15 minutes exposure to sun at least twice a week, because it can be synthesized in skin if we are exposed to sun. If we have a vitamin D deficiency, then we could have rickets or osteomalacia. On the extreme end from deficiency is toxicity. If we consume too much vitamin D, then we could become toxic. And that means don't take mega doses of vitamins, thinking, well, if one pill does good, I'll go ahead and take 2, or I'll take 3, because you could literally build up with that. Remember, it is a fat-soluble vitamin. With K, as you guys know, that's needed for blood clotting. And you can actually give it as a medicine in someone who's having a bleeding disorder. It helps influence our bone metabolism. A good source of vitamin K are those green leafy vegetables, cheese, milk, egg yolks, meat. And it can be synthesized in the intestine from bacteria. Unlike other fat-soluble vitamin stores of vitamin K can be more quickly depleted than the other A, D, E vitamins are. It is given routinely to newborns. They cannot produce vitamin K from gut for 24 hours. So this way it enhances their prothrombin production and helps prevent hemorrhagic disorders for your newborns. Eating large amounts of vitamin K can negate the effect of the blood thinner Coumadin. If you are someone who does eat certain amounts of these green leafy vegetables, you need to consume about the same amount as you have been, but you shouldn't all of a sudden be one who has not been eating a lot of collards or a lot of greens, and then you go in and eat a large serving of it at one time, because it can really decrease the benefits from the Coumadin. A lot of times we say, on their trays it may say no green leafy vegetables. So it shouldn't be excessive or sporadic large amounts of vitamin K, but you can let them eat some. Some people are so strict and they say, no, you can't have any green leafy vegetables, but that is not true. They just shouldn't go and gorge themselves out at different times on these green leafy vegetables. Have a small amount. And another thing is that antibiotics kill the bacteria that synthesize vitamin K. So if our person's clotting time is too elevated, we may actually go in and give them a vitamin K shot if they're on Coumadin. The last fat-soluble vitamin is vitamin E, and this is an antioxidant. It may help prevent diseases, cancer, neurologic disorders, or cardiovascular disease. Vitamin E helps maintain cell membrane integrity and protects our red blood cells. The big source of vitamin E is vegetable oils, especially in olive and canola oils. We also get it from leafy vegetables, nuts, whole grains. If we have a deficiency in vitamin E, that is considered anemia. After fat-soluble vitamins, we have our water-soluble vitamins. C and B complex vitamins are soluble in water. They can be affected by how we prepare our foods or our cooking methods. So if we are boiling our foods, especially if we are boiling something with the top off of the pot, then we're really losing a lot of vitamin C from that vegetable. We don't store these vitamins, so it's not common to become toxic from your water-soluble vitamins. But you do need to have daily supplies because we're not storing it up in our tissue reserves either. It's only maybe 3 to 5 days worth of vitamins we have stored on board. With vitamin C, especially the antioxidant called ascorbic acid, this is needed for wound healing. It helps with our absorption of iron. Remember, way back you learned that if you eat a slice of tomato on a hamburger, you actually get 4 times the amount of iron from that meat as if you leave the tomato off. Just like when we're giving someone their vitamins or their iron pills in the morning, it's really good to take them with a glass of orange juice because it helps absorb that iron. As our amount of vitamin C increases that we eat, our absorbed amount decreases. So we really literally excrete it in the urine. So the one selling you all those expensive mega doses of vitamins, in reality you are just excreting any over amount in your urine. Good source of vitamin C is, citrus fruits, orange juice, broccoli, and greens. Deficiencies, if you have a deficiency of vitamin C, and this is one that many, many years ago the sailors were notorious for having, it was called scurvy. They would have delayed wound healing, painful joints, and loose teeth. And you smokers out there should know that you deplete vitamin C faster than non-smokers. So you really need a little bit more per day than the non-smokers do of your vitamin C. And you remember many, many years ago they found out if they took barrels of, they would take usually limes or so on the ships with them when they went on their trips to help prevent the deficiency or help prevent scurvy. B1 or thiamine is needed for nervous system and our energy production. Our source of thiamine is often, of course, your whole grains, fortified cereals, nuts, and pork. If we are deficit in B1, then we may be confused easily, may be fatigued. And when we eat enriched breads and cereals, they really, start reading your packages and look at your labels on your breads and on cereals, and it will say that it is enriched, and that means it's got these vitamins added in. Now, this is good except for your alcoholics. Alcohol abuse alters thiamine intake and can cause deficiencies in your alcohol abuse clients. B2 or riboflavin is needed for energy metabolism as well. And if you're Deficient in B2, you may have dermatitis or even lesions on your mouth. B3 is the niacin, and that's needed for healthy skin. And you could get niacin from things like peanut butter, grains, nuts, and poultry. Deficiencies of niacin, you will see pellagra or rough skin. And usually here in the U.S., we're not deficient in niacin except for your alcoholics that I mentioned just a second ago. Large doses of niacin may be given to lower cholesterol. You may see people trying this over-the-counter method or go to the health food store and buy a lot of niacin trying to get their cholesterol levels down. But one thing about it, they need to be very careful because a heavy dose of niacin can really cause a lot of flushing of the face especially. And you should only take large doses of niacin under the supervision of a doctor. B6 is needed for blood formation and to help maintain that nervous system. And you don't usually see any deficiencies here in the U.S. from a B6 vitamin. B9 is folic acid, and y'all remember folic acid from your maternal child or OB course. Folic acid is needed for blood formation and fights neural tube birth defects. That's why it's so important for females to have an adequate supply of folic acid before they become pregnant, or especially in that first trimester. The source is leafy vegetables, milk, and eggs. B12 is something that most of you are very familiar with, I'm sure, because you may give B12 on a weekly or monthly basis to some of your residents if you work in long-term care. And B12 is needed to help mature the red blood cells. They help prevent pernicious anemia. And we get B12 from meats, egg, cheese, and milk. So if we have a deficiency in B12, then we are considered anemic. And remember that all of our animal foods contain B12. B12 does require an intrinsic factor that's secreted in the stomach to be absorbed in the ileum. So if someone has had gastric surgery or had part of their stomach removed due to either ulcers or cancer or whatever, then they will not have this intrinsic factor to absorb. So they automatically have to go on B12 shots. 10 to 30% of people over the age of 50 may have a B12 deficiency. Minerals. They are inorganic substances. They're required in small amounts, and they cannot be synthesized in the body, so they have to be obtained from food. We can't make our own minerals. Essential constituents of all cells. They form the greater portion of the hard parts of the body, for example, bone, teeth, nails, and they are essential. We do store minerals. There are two categories of the minerals. We can have macro or we can have micro minerals. Macro just simply means you need greater amounts of them. And you need these daily, such as maybe calcium, sodium, potassium, phosphorus, magnesium, chloride. And then you have micro minerals that you take less than 100 milligrams daily, such as iron, zinc. Calcium are one of your macro minerals, and we need about 1,000 milligrams daily. If you're over the age of 50, you really need 1,200 milligrams of calcium. And as you know, they help for bones and teeth. We need it for blood clotting, nerve transmission, muscle contraction, and relaxation. Vitamin D is needed for increased calcium absorption. Sources, as you know, milk and milk products, leafy vegetables, and salmon. look for calcium in fortified products like orange juice, and it will tell you on the label that it's how much % calcium it has added or fortified. If we are deficient in calcium, then we could have osteomalacia or osteoporosis. And we usually do not become toxic not by eating too much calcium. Anyway, phosphorus is essential for bone and teeth, of course, and phosphorus helps with that acid-base balance. It is best when we take calcium and phosphorus in a 1-to-1 ratio, and it is enhanced by vitamin D. We find it in foods rich in protein and calcium. It is kind of rare for someone to have a deficiency of phosphorus, but you will see it in certain diseases, particularly chronic kidney disease. Magnesium is needed for relaxation of our smooth muscles. And you can, this is one example, you say, well, I need to eat my chocolate today because that's how I'm getting my daily magnesium dose, because it is found in chocolate, as well as nuts and green leafy vegetables, grains, and seafood. If we're deficient in magnesium, we may have muscle cramps or neurologic disturbances. Iron, something that you have been, I'm sure, had a lot of experience with by now with your patients. Iron is a trace element, and it's needed to help form hemoglobin, as we mentioned earlier. And if you're having to give liquid iron to your patient, make sure that they drink it through a straw, because it literally stains the teeth. And we absorb it better if our body actually needs the iron. So your red meats, leafy green vegetables can help, are good sources of iron. However, if you're one who drinks a lot of caffeine, eats a lot of fiber, or a lot of antacids daily, then that's going to interfere with absorption of the iron from your food products. And as you know, if we're deficient in iron, we are anemic, and that means we may be pale. You may see fatigue, weakness. And then on the other hand, if you take a lot of iron supplements, then it can cause the person to be nauseated, have constipation, and have dark stools. Iodine is needed to regulate your basal metabolic rate, and we get iodine from iodized salt and seafood. If we have a deficiency in iodine, then you may see a goiter, or where the thyroid is becoming enlarged. Potassium is needed for our water balance, our nerve impulse conduction, and, of course, contraction of the muscles. Remember the heart, how it really is affected by potassium, whether it's low or high. The source, of course, your fruits, especially orange juice, bananas, leafy vegetables, whole grains. If you're deficient in potassium, then you will have muscle weakness, cardiac problems. And also the same if you've got an excess potassium, it's going to cause arrhythmias. Chloride is needed for our acid-base balance. So is sodium. And sodium is the major role in water balance and nerve impulse transmission. We get the majority of our sodium from salt. And if we're not have enough sodium on board, we can really have muscle cramps. But then again, if you have too much sodium, it really causes high blood pressure. And different ethnic types are more sensitive to sodium intake than others. And there is a new guideline out today on some of the new food guidelines. You know, they revisit those every 5 years and try to come up with new guidelines. But sodium is one of the major changes where they're saying we really need to decrease our sodium intake. And unfortunately, we get a lot of that from our processed foods here. Things like canned soup, canned spaghetti, canned ravioli. Any of those kind of processed things are very high in sodium. When you're looking at the person For their nutritional status, some things you need to consider, of course, are their height, their weight, what is their history, do they have any clinical signs of poor nutrition, what is their energy level, are there factors affecting their nutritional status, like limited mobility, maybe they live alone and can't prepare all their foods if they need to. Maybe they have different diseases or disorders that's affecting their nutritional status. Maybe they're an alcoholic. The requirements each person needs varies according to their age and growth. And the growth periods, of course, especially early childhood, they do need increased calories. Men tend to have a higher metabolic rate due to a higher amount of muscles in their body. Pregnancy causes our caloric requirements to increase. If it's colder, then your metabolic rate will decrease. And health and illness, increased temperature equals an increased metabolic rate. So if we have a fever, it's automatically going to increase. If we are malnourished, our metabolic rate decreases. And then, what type of food is a person consuming? How active are they? The more active we are, the higher our metabolic rate is. There are a lot of different things that can affect our eating, whether it's our culture, religion, socioeconomic status, personal preference, emotions, and health. Some people can't eat if they're upset or if they're very depressed. Some people eat if they are depressed or upset. So emotions can play a big role. What did our family do? Did our family all gather around the dinner table at night and it was a relaxing meal where everybody kind of shared together? Or is it everybody got their plate as soon as they come in and went wherever, maybe went and sat in the living room, watched TV, or went to their bedroom or whatever, and nobody ate together? There's a lot of different factors that can influence our eating habits. And certainly religion and culture play a big part of that. When we're looking at BMI, or body mass index, if you've ever joined Weight Watchers or any of these things that they always say, what is your BMI? And it is really a common clinical index for obesity. And it can also indicate if someone is underweight. So when you're looking at BMI, you take person's weight times 704. You take their height in inches times height in inches, and that is B. And then you do A divided by B equals a BMI. So A again is their weight, how much does the person weigh, multiplied times 704. B that you're solving for is what is their height. Are they 60 inches? Then you would do 60 times 60. That's B. So then you simply divide A by B. So it's their weight divided by height. And that gives you a BMI. Ideal BMI is anywhere between 20 to 25. These are the lowest risk for obese diseases, such as diabetes, stroke, cardiovascular. If the person is 25 to 30 BMI, they're overweight. If they're greater than 30, they are considered obese. So right now, take your, let's look at your BMI, take your weight and multiply it times 704. Take your height and multiply it times itself. Let's say if you're 64 inches, then it would be 64 times 64. Now divide B into your A number, and that gives you your BMI. So, and your ideal body weight, there are different charts in nutritional books about what is your IBW. insurance companies often have these IBWs. What is the ideal body weight? If you, we said that greater than 30 is obese, and greater than 40 is considered morbid obesity. So if you are in the obese range, you do have an increased risk for the three that we mentioned earlier, obese diseases: cardiovascular, diabetes, and stroke. Obesity, our different requirements are influenced, of course, as some of the things we've already talked about: our age, our gender, physical actions. And usually we need about 20 to 35 calories per kilogram of body weight. If we're very active, we need to go with the higher side, or if we're critically ill. If we're very sedentary, we're just sitting around all the time, just watching TV or playing computer games or something, then it needs to be on the lower side. The best way to approach to start losing weight, if the person is overweight, try to improve the quality of food. Look at them and teach them what are the portion sizes? How can they eat healthier foods? How can they change some of those unhealthy eating behaviors, such as eating snack foods out of the box or the packages rather than pouring them out in a plate so you can actually see how we're eating. There is a link, of course, with your therapeutic component, improving activity patterns. And you all know the best way to benefit and improve your activity is to increase your physical activity. That helps you with your managing your weight. It helps improving your mood, helps relieve depression, can lower your blood pressure. It gives you an improved sense of well-being. And it also helps when, especially for females, when they're older and they start having osteoporosis, they need to go on some physical activity to help prevent that bone mass from deteriorating. It certainly improves the general quality of life. What do we look at to help encourage someone with their nutrient intake? You want to, if as much as possible in a hospital setting or in a nursing home setting, try to provide foods that they like. And I realize that this is hard sometimes. Consult with a registered dietitian. What are some environmental changes we need to make to help improve their nutrient intake? This is the top part of the pyramid, and please go to mypyramid.gov to look at the entire picture on the internet. So you can see, we couldn't get it all to fit, but if you look at the pyramid, grains, vegetables, fruits, milk, and meat and beans, you'll see at the bottom. And then another slide, it talks about we should eat a 3 ounce of whole grain breads, cereals, crackers every day. This says eat at least 3 ounces per day. Some people eat that much per meal, so they are getting too many grains in, believe it or not. Especially people who eat a lot of breads. Vegetables, you should remember to try to eat different vegetables, a variety. Try to eat more orange vegetables, and eat things like dried beans and peas. Fruits should be the same thing with a variety. Fruits are preferred to fruit juices. And when you're looking at milk products, try to choose low-fat or fat-free when you get milk, yogurt, and milk products. Now, some people can't drink milk. they're lactose intolerant and all. So there are a lot of different products out there now that are lactose free. With your meat and beans, try to choose low-fat or lean meats and poultry. And bake it, grill it, or broil it. Or grill it. No frying is listed on here. And you know, here in the South, we do tend to fry a lot of things. We even fry things that we shouldn't fry, like green beans and cheese and things. If you don't think that, look at appetizers on the menus now. It looks like if they can put batter on it and stick in a fryer, they will. They do things like pickles and all kind of things. It's like if it'll hold the batter on it, we're going to dump it in the hot grease for some reason. When we're planning a meal, remember to try to include all of the food groups. You want a variety of colors. When you serve a plate, especially think about when you're preparing a meal and you're having guests come over, you don't want all of your vegetables the same color. So try to have a variety of different colors, different textures, and different flavors. And it does depend a lot of times on our personal preference and our sociological standing. How much money do we have to go buy the food? Groceries are so expensive nowadays. The prices just keep going up and keep going up. And you can see why so many people are choosing lower cost alternatives. For example, things like to go get a bag of dried beans or a bag of rice is less costly than to go buy fresh green beans, a bag of oranges. I mean, some of these fruits, you pay over $5 just for a bag of them, of different kind of fruits. So cost is a big factor for most people when they're preparing their meals. Hospital food. Usually we don't go to hospitals to eat there if we have a choice. And yes, I know there's some hospitals have really good cafeterias, but then as a rule they don't really have a positive image for most hospitals. And if your physician orders a diet is tolerated for your patient, then usually you have to specify what kind of diet. So you really want to check with the patient, find out what is their appetite, what is their ability to eat and tolerate the food. Some common diets, just a brief review for you guys, because you're doing this, I know, almost on a daily basis. You can have either full or clear liquid diet, pureed, soft mechanical soft, low residue, low fat, diabetic, or even the acid ash diet. For your person that's getting a regular diet, these are people who don't have altered nutritional needs. There's no foods that they're restricted from, and usually this is where they get to go in and select. The dietary department will come and bring the menu around for the next day in most cases, and so the person gets to really choose what they want in their meals. Diets with, if they have a specific number of calories, they're ordered to either promote weight loss or provide a consistent caloric intake. Example, your diabetes clients. They will have a specific number of calories. They will have, the doctor will order 1800 ADA diet or 1600 ADA, just whatever the number is that the person is usually on at home. It can range anywhere from 1,000 to 3,000 calories a day. And when they are wanting the person to gain weight, then they usually say high calorie diet, and they don't really give a number. They're just trying to encourage the person to get more calories in. With clear liquids, you know, it's a very restrictive diet, only to be used short term. And typically it's composed of clear fluids or food that becomes fluid at body temperature. So that's why you can have clear jellos on a clear liquid diet. These require very little work on our part to digest them, and they provide hydration and some electrolytes, but they don't really have enough calories for most people. So you do not use clear liquid diets long term. Things like coffee, tea, popsicles, clear fruit juice such as apple or grape can be offered in clear liquid diet. If it's full liquids is more suitable for long-term use, but it may still be inadequate in some nutrients. A lot of times you see this as a transition between when they're advancing a clear liquid diet before they start on the soft, they will say, well, let's try full liquid diet first. So it's kind of the in-between. It can be contraindicated in someone that is lactose intolerant, because in full liquids you tend to see a large amount of milk used to help provide the calories. So you can have everything on a clear liquid diet, plus you can have milk and puddings, fruit juices, vegetable juices, butter, margarine, cream, those sort of things you can have on a full liquid diet. If it is pureed, as you know, these are foods that are blenderized to like a liquid consistency. And they can put any type of food, but it's just changed to a liquid consistency. You may see this for people after oral surgery, or maybe they have their jaws wired together, falling trauma, or if they have trouble swallowing and chewing. Soft diet, your increasing is still low fiber, usually moderately low in fiber, and it may be lightly seasoned. And your texture can range from smooth to creamy or even slightly crisp. You get cooked vegetables, cooked or canned fruit, easily digested raw fruits, such as maybe pears, refined breads, eggs, smooth peanut butter, cheese, and lean tender meat. This is used when a regular diet is not tolerated, or even if you're transitioning someone from a full liquid to regular, you may try soft for a day or two. If it is mechanical, that's modified in texture only, and you'll have things will either be chopped or ground or mashed and pureed. You see this when someone has limited chewing ability. Maybe they don't have the teeth, or if they've had oral surgery. Remember, the ones who consume low-fat diets typically consume fewer calories. Unsaturated fats are good fats because they do not raise that serum LDL cholesterol, the bad cholesterol, the low-density lipids, or bad cholesterol levels. Saturated fats found in red meats, dairy products, shortening, raise the LDL cholesterol, which increases our risk for heart disease. Someone on a very low-fat diet will not feel full, and typically they stay hungrier. Someone that has a sodium-restricted diet, maybe if they have CHF, it's probably very common that you're used to, renal disease, high blood pressure. They're trying to restrict their sodium. And you make sure, no matter what kind of sodium-restricted diet they're on, it depends on what level, you want to limit sodium processed food and beverages. So a lot of your soft drinks are high in sodium. Diabetic diets, these are usually based on the exchange list, and that's kind of just a framework to help provide diabetic diets. And it supposedly helps the person choose a diet that is healthier, that is more consistent in the total calories and amount of carbohydrates, fat, and protein that they take in daily. Usually the ones that you've probably seen more common are your ADA diets, and it depends on the number, and they have a certain amount or certain percentage of the carbohydrates, fats, and proteins in that diet. The thing is, the ADA no longer really endorses a single meal plan anymore, but I know a lot of you are coming from, where a lot of your physicians are still ordering 1,800 calorie ADA diets, because it's something that they are so used to over the years. So it's really saying, ADA is trying to back us and say, wait a minute, don't use our name in this. So they're really trying to get people away from recommending ADA type diets. And dietitian, they may see the person while they're in the hospital, but as you know, if we get a patient in late on Friday evening and the hospital doesn't have dietitians in over the weekend, often the nurse is the one sending them home on Sunday afternoon when they're ready for discharge, rather than the dietitian getting to meet with them. One diet that you may have seen before is something called the acid ash diet. This diet helps treat calcium kidney stones. It helps to acidify the urine, so it makes the urine more acidic. And in this particular one, you try to, you can either increase, with acid ash, you're trying to increase your meat, cheese, grain, and eggs. And then you're limiting your vegetables, milk, fruit, and cheese. So it really depends on which, if you're wanting to go more, it depends on which diet, what is the person's problem. Are they having too much calcium and all? So you need to know that before you go in and limit, whether they need to limit their meat or limit their vegetables and milk. With your nose, all of you guys know this by now, what is considered in the intake and output. And don't forget, a lot of times we're really good at remembering things like urine, but we don't often chart vomitus. You know to chart if your person is on a NG tube. You know to chart that drainage from that. But sometimes we tend to forget to look at the other output that the person may have. When you're inserting an NG tube, make sure you do review that with your techniques or skills book that you have. Any of them should be fine. Be sure and review that. And I'm sure probably all of you guys have put in an NG tube by now. But do make sure you got all of your supplies before you go into the room. And make sure that you do measure properly before you put, because you've got to mark that NG tube before you start putting it down, or your pilots do know how far you need to go. So be sure and review that procedure. And to encourage their intake, of course, try to get dietary involved. If you see this person's not eating their meals, let's say this person needs feeding and maybe there's no family there at meal times, and as you know, it's very hard for us to get help in there to feed these patients all at meal time. You do need to try to make sure the tray is set up, because it's very disturbing to the patient for someone to come walk in and bring the tray, and maybe the bedside table is a little bit far away and they can't reach it for whatever reason. Maybe they have very limited mobility and they cannot reach the tray. So that's not good. Make sure that it's close enough and that the patient has everything that they need. And please remember their hygiene also. Offer maybe warm bath cloths to wipe off their hands with some soap on it or something, so they can wash their hands before they eat also. Our supplements, as you know, come in all different flavors, kinds. It could be anything from like Boost to Ensure. There are, of course, diabetic problems. If someone can't get enough calories in, supplements are really good. And they tend to, most of them taste pretty good. Boost, probably, I've heard more people say Boost tastes a little bit better than Ensure, simply because Ensure tastes so much like vitamins. But it can also be that the person maybe does the milkshakes, or they may do Carnation Instant Breakfast to help, if they're at home and all, to help try to get a little bit more calories in. When we're looking at enteral nutrition, This is getting nutrients either by mouth or tube into the GI tract, but enteral, typically we're referring to tube feedings. And if the person can't get enough oral intake, or maybe the GI tract is at least partially functional, then they can have tube feedings. And it is advantageous over parenteral, because parenteral, remember, is by vein. And because if we're using the GI tract, it helps maintain function by preventing that gut from atrophying by not being used. Just remember to have your person on I&O if they are on enteral nutrition. It is, the person usually feels a little bit more normal than if they're being fed strictly by Hyperal or TPN through the vein. It is recommended for patients who may become malnourished before they're able to consume an adequate intake. But if that gut is non-functional, let's say, for example, an intestinal obstruction, an ileus, severe diarrhea, then you don't want to be putting tube feedings in because you may exacerbate the problem. There are different types. Some of these you're familiar with: Osmocal, Osmolite, Isocal, Jevity. And then you can have certainly specialty formulas. Remember, you should infuse them at room temperature. But if you've got someone on tube feeding, remember to always check residual before feeding the patient. And the head of bed should be about 45 degrees at an angle, at least during, and at least maybe about an hour after, if you're giving bolus type tube feedings. If the person is diabetic, they can have Glucerna. People with your COPD, you may see put on Pulmicare. Your chronic dialysis or renal patients will be put on a different brand. But most of these products are hypertonic. So if we're giving them full strength, just remember that high osmolality draws water into the intestines. It dilutes the concentration, but it causes cramping, nausea, and diarrhea, or the dumping syndrome. So if you start tube feeding, start at a slower rate or strength. And make sure you review the difference between intermittent tube feedings versus bolus feeding. And intermittent feedings are usually infused by pump over about an hour. If it's a bolus feeding, usually that is delivered in a syringe over about 15 minutes. You do that maybe 4 to 6 times a day, which is something that you see often in your long-term care if the person's on feeding tube. If it is continuous, then they're getting it on a pump at a much slower rate. Remember, a lot of hospitals, and I will put for you to check residual even on the MARs, to just simply remind you to always check residual before starting up that bolus or that intermittent feeding. Parenteral, as I said earlier, is nutrients going directly into the bloodstream. So we're bypassing the GI tract. This may be when the person is just physically or psychologically compromised so much that they can't consume enough nutrients orally or enterally. And it includes also things like electrolytes, fats, vitamins, trace elements, and all that can go along with the parenteral nutrition. If it is called PPN, that is peripheral parenteral nutrition, it has to be a low concentration of dextrose and amino acid to prevent phlebitis. TPN is infused through an indwelling central venous catheter, or your VAD devices, your implanted ports, your Groshon catheters, that sort of thing. That TPN can go through there. If it is peripheral, then it has to have a lower concentration of dextrose to help prevent those veins. So usually our interventions depend on the person's willingness and ability to change behavior patterns. if our person is not committed to changes, even the best nursing interventions you can write or come up with will not always be successful. And it's just like you. A lot of times we know what we should do or we shouldn't do or eat, but then we just because we know that something's not good for us does not mean we do not we do without, right? If it's something that really looks good, we may actually go and try it even though it's not good for us. So be sure and remember to individualize a care plan and focus on the patient and their needs. Thank you.